The operating room, surgical planning. This chapter goes over the general determination of surgical approach. So from the beginning that you meet the patient to the time you go into the operating room. We'll review the preoperative evaluation, which includes history, physical exam, diagnostics, imaging, as well as the patient's comorbidities. And we'll talk about whether surgical intervention is indicated in an urgent manner or if you need to do it in an elective manner. Other things to consider is when you're doing your preoperative evaluation, you might need to just observe the patient, meaning surgery may not be indicated, or you might need a further workup to make that determination. If something's time sensitive, it might become urgent. That means that you have to get adept at reviewing all the basic health concerns prior to getting into the OR and creating essentially a checklist for yourself because time is of the essence. For elective cases, you have more time that can be used to plan the approach, the anatomy, and if you need further preoperative evaluation, then surgery can wait. A little more info about the preoperative evaluation. As I mentioned, you should create a habit of being thorough. Having a personal checklist of how you do this is one of the best ways you can make sure that you get all the right points every time. History and physical is very important for every patient. Make sure you understand the time course, the pertinent positives and negatives. And of course, you have to do a thorough neurological examination. This includes mental status, speech evaluation, cranial nerve function, motor and sensory function, reflexes, as well as cerebellar gait testing. In spinal cord injury, rectal tone is very important, as well as the bulbocavernosus reflex. Every time you see a patient, you should know what surgical interventions they've had. This can be done by just looking at the patient's skin if they can't speak to you, but of course just asking the patient should suffice. Diagnostic studies are very important. Labs, imaging, make sure patients' coags are within normal limits, that you have a type-in screen and that blood is available. If the patient is of childbearing age, then you may need a pregnancy test, and of course EKG, chest x-ray, and your imaging. Very important to remember, you must check if the patient is on blood thinners. Sometimes the patient can be on blood thinners and the coags that return from the lab are still within normal limits. Neuroimaging studies. Now, different pathologies will necessitate different imaging. So, plain x-rays, CT, MRI, catheter angiography, various different tools are available to you. So when you have a pathology or if you're looking for something, you should be able to decide which imaging is going to help you further decide which operative approach you need to take. If you need intraoperative neuronavigation, then you need to make sure you get that imaging and that it works properly before getting into the operating room. This will also be important to take into consideration when you're positioning the patient and your approach. You should make sure that you'll still be able to use the navigation as you're operating. And this cannot be stressed enough, but you need to make sure that this imaging has been reviewed and that they're available during the procedure. Preoperative discussion and assessment by the anesthesiology team is vital to a successful and safe surgery. Now, the anesthesia team, their job is to do a preoperative assessment, but where you come in hand is you need to make sure you have a discussion about things that are important to you during the case, things that are important from a neurosurgical perspective. For example, hemodynamic expectations. Are you clipping a ruptured aneurysm? Do you need their systolic blood pressure below a certain amount throughout the whole time? Are you dealing with an intramedullary Spinal cord tumor, do you need MAP goals greater than 85? These are the types of things that you need to communicate to the anesthesiology team. A brief overview of the general considerations for cranial procedures. Of course, positioning, you have to make sure it's ideal for you and for the patient. And the accessory things to consider, such as neuromonitoring, positioning assistance, critical concerns for the anesthesia team. If ICP is going to be an issue, then you need to make sure that the patient's head can be elevated during the case, whether diuresis is needed, estimated blood loss or expectations. Does blood need to be in the room? And you need to make sure that your surgical tech and OR staff are familiar with the case and the equipment. And this is very important for technical preparedness. And as a surgeon, you and your team should be adept with the microscope, endoscope, neuronavigation, and any other tools you may need. Oftentimes, if you need to coordinate a case with other specialties, this would apply there too. For cranial tumor cases, make sure you have a clear working diagnosis and plan. Whether you plan on doing a biopsy, partial resection, full resection, or a combination. Again, are you going to need monitoring, motor or speech mapping? Is the patient going to be awake? Similarly, your surgical instruments should be prepared accordingly. In cases where you're expecting a CSF leak, make sure that you've told the patient and prepared the abdomen or thigh in case you need a fat or fascial graft. If you plan on using fluorescence, make sure that it's available to you and that the anesthesia team is aware. For cerebrovascular cases, again, make sure you have a thorough understanding of the pathology. You have maximal utilization of your endovascular adjuncts, whether it's just a preoperative angiogram or assessment by the endovascular team. In these cases, your equipment is also going to be very important. Aneurysm, AVM clips, intraoperative fluorescence, intraoperative angiography. Make sure that your surgical tech is familiar with all of the clips and can communicate their availability to you. Proximal control is very important in cerebrovascular cases. Again, if you plan on dissecting the neck in case of an emergency, make sure you communicate this to the patient and that you prepare the site during the prep and drape time. If you plan on using a artery graft or a vein graft from a different site, again, make sure you confirm that it's patent and have your Doppler available. For spinal procedures, you should be certain about the approach you take and whether it's going to be anterior, lateral, posterior, or combined. When you position the patient, you should take into account all the accessories you're going to need. Bed attachments, for example, for MIS cases, whether or not you'll need navigation, and your ability to take radiographs. Radiographs are very important during the case. If you're positioning a patient, make sure that the bed you're using is compatible with your X-ray. For neuromonitoring, if you need pre-positioning and post-positioning baselines, communicate it to the team. What extraspinal anatomy are you going to traverse while you're working? It's important to be aware of this and also to prepare for any sort of blood vessels or anatomy you may encounter. The hardware and instrumentation you may use needs to be prepared, sterilized, and available before the start of the procedure. It's important to communicate this to industry representatives and have backups on hand. When working with spinal tumors, make sure you appreciate the anatomy and location of where you'll be working. Is it extradural, intradural extramedullary, or intradural intramedullary? All of these will help you navigate the surgery like an expert. Now, in conclusion, because of the complexity of neurological surgery, you must use every means available to optimize patient outcomes. Your surgical success begins long before you're in the operating room. And the foundation for this lies in the disciplined preoperative routine, history, laboratory studies, imaging findings, physical exam. Neurosurgery will always remain among the most audacious of human endeavors. Preoperative planning provides the footing to help patients and diminish the burden of neurological disease.